Hello, I'm Dr. Robert Hamus, a plastic surgeon and the inventor of the IDEAL implant. I want to welcome you to our network of board-certified plastic surgeons throughout the U.S. and Canada who are offering women this new technology breast implant. The idea for the IDEAL implant came from listening to my patients. I realized that women want a breast implant that combines the benefits of both saline and silicone gel implants without having to accept the well-known compromises associated with each of them. To develop this new type of implant, I founded IDEAL Implant Incorporated in 2006. Recently, I retired from my private practice in Dallas and now serve as CEO and president of the company. Over the years, our team has refined the implant design and manufacturing quality. We will soon complete our 10-year U.S. clinical trial with over 500 women. FDA and Health Canada approved the IDEAL implant in November 2014, and we began sales in September 2015. The IDEAL implant is a new technology, third type of breast implant. Compared to a saline implant, which is just a water balloon, the IDEAL implant has an internal structure that supports the edges to prevent wrinkling and supports the upper pole to prevent collapse when upright. This internal structure makes the IDEAL implant feel natural, with only saline inside for a woman's peace of mind. Compared to silicone gel implants, the IDEAL implant has a significantly lower risk of rupture and a lower risk of capsule contracture. There is no risk of silent rupture, so no need for the FDA-recommended MRI scans to detect rupture. With the IDEAL implant, a woman can simply look at her breasts and know that her implants are intact. Because the IDEAL implant has an internal structure, it is called a structured breast implant. It has a series of nested shells, 3 to 5 depending on the size, with 2 separate lumens or chambers. The inner lumen is filled through a valve on the back, and the outer lumen is filled through a valve on the front. Because there are 2 chambers, the implant won't go flat if one chamber deflates, so unlike a saline implant, a replacement can be scheduled electively. The internal structure supports the edge so it does not wrinkle, and supports the upper pole so it does not collapse when upright. In effect, the internal structure supports the shell of the IDEAL implant, the same way cross-linked silicone gel supports the shell of silicone gel implants. Compare the IDEAL implant to a silicone gel implant to see how the edges of the IDEAL implant stay smooth and the upper pole does not collapse when upright. In addition to providing support, the internal structure of the IDEAL implant controls movement of the saline, so it does not bounce. It behaves like a silicone gel implant. The edges of the IDEAL implant were designed to be low and fit close to the curve of the chest wall. The implant is tapered from the dome to the edges, so the IDEAL implant does not bulge out laterally toward the arm. Our website has side-by-side photographs of the IDEAL implant compared to other manufacturers' implants. The implant has a smooth surface and comes in 14 sizes. At this time, there is only one profile, somewhat like a high profile, but with more tapered sides. The total implant volume includes the volume of the empty implant plus the volume of the saline put in the inner lumen plus the volume of the saline put in the outer lumen. The total volume of the IDEAL implant is not just the saline put inside, but includes the volume of the empty implant, 3 to 5 shells, and the patch. This is the same as for a silicone gel implant. The total volume includes the shell and the patch. The outer lumen is adjustable within a fill range that is proportionate to the size of the implant. So the larger the implant, the larger the fill range. You should not overfill this implant. It was designed to look good at the minimum fill volume, which is called high. You can adjust up to the maximum fill volume, which is called 100%. Here you can compare the IDEAL implant at minimal fill volume to the Allergan Style 15 implant. And here you can compare the IDEAL implant at maximum fill volume to the Allergan Inspira SRF, SSF, and SCF implants. When looking at diameters and projections, be aware that the IDEAL implant was measured on a curved surface simulating the curve of the chest wall, not on a flat surface like for other implants. So on our size chart, the diameter is about 5 millimeters less and the projection about 5 millimeters more than if the IDEAL implant was measured on a flat surface. When comparing to other implant size charts, be sure to convert the dimensions. Our FDA clinical trial included 502 women for primary and revision augmentation at 35 private practices throughout the U.S. Patient and surgeon satisfaction has been high. At this point in the trial follow-up, the IDEAL implant results are impressive compared to the trial results from silicone gel implants. The capsule contracture rate is lower than other implants. Because the internal structure resists compression and stretching of the implant shell, there is probably less repeated microtrauma to the surrounding capsule during activities of daily living and less stimulation of contracture. The rupture rate is significantly lower than other implants, probably because the internal structure prevents the shell from folding upon itself, which could lead to fatigue failure. Also, since the IDEAL implant shells are dipped on a robotic machine instead of by hand, they are more uniform, minimizing thickness variations that could be stress points leading to fatigue failure. The company's marketing programs are directed to women, so they become aware of the advantages of the IDEAL implant over saline and silicone gel implants. This causes women to seek out one of our network surgeons who offer the IDEAL implant and to ask for it by brand name. This is already happening nationwide in response to efforts with social media, PR, online and print advertising, our website, Real Self, and digital content from our surgeons that is published online each month. Your office marketing is also directed to women and includes information about implant options. Today's women want to make their own decisions, especially when it comes to what is going into their body, and they expect to be fully informed about product choices in an unbiased way. Until IDEAL implant was available, it was easy for you to dismiss women's concerns about silicone gel because the saline implant did not feel natural and was not a reasonable aesthetic option. Now the saline-filled IDEAL implant has virtually the same natural feel as a silicone gel implant. So what do? Some practices don't change. They continue to promote silicone gel implants and dismiss IDEAL implant simply because it is filled with saline, even though it feels natural. But women get multiple consultations and tend to select the surgeon who they perceive is unbiased, just laying out the facts. We have seen that network surgeons who present the option of the IDEAL implant and silicone gel implants in an unbiased way tend to have higher conversion rates and do more cases, regardless of which implant the patient chooses. Why? Because women trust a surgeon who gives them choices without subtly pushing them to silicone gel. To help you present the benefits and compromises of silicone gel implants and IDEAL implant in an unbiased way, just the facts, we have prepared a woman's guide to implant choices. This will help anyone in the office walk a patient through their choices so they are informed and understand the benefits and compromises of each type of implant. The time has come to ask yourself, why use silicone gel implants instead of IDEAL implants? On a tabletop, the IDEAL implant feels natural and very similar to the silicone gel implant. So you know that once implanted, any differences in feel will be imperceptible. The issue with silicone gel implants is that ruptures are silent, which concerns women. They don't know if their own implants are intact or ruptured without an MRI, and even that is not always accurate. Obviously informed, health-conscious women want to know what is going on inside their body. The results of large randomized surveys of women, including surveys of registered nurses, women physicians, and even women plastic surgeons, confirm that women want to know if their silicone gel implants are ruptured. And if found to be ruptured, they want the implant removed, even if asymptomatic. Most people do not know that the cumulative rupture rates of silicone gel implants over 10 years are very high, 9 to 24% in the MRI cohort for primary augmentation. Bear in mind, this is FDA core study data for these implants. And what should women expect the rupture rates to be beyond 10 years? The IDEAL implant is the alternative to silicone gel that women want. Natural feel, only saline inside for peace of mind, no silent ruptures, and no FDA-recommended MRIs. We will provide you with marketing materials, such as office displays, patient brochures, and size charts. The cutaway drawing on the size chart is useful to show patients the internal structure of the implant and to explain the nested shells and 2 lumens. In addition, you will receive emails providing you with digital logos, implant images, and other marketing materials to use on your website. It is a good idea to email the digital copy of the patient brochure to patients prior to coming in for their consultation. It informs them about the IDEAL implant in advance, saving time during the consultation, and lets them know your practice is up to date and offering the newest technology breast implant. Your sample is a 335cc implant filled midway between high and 100%. It must be kept wrapped in the moist white cloth and in its closed container, otherwise the saline will evaporate out and the implant will lose volume. So when you are not showing it to a patient, wrap it in the moist cloth and keep it in the closed container. The sample implant was sterilized and filled with sterile saline. If the white microfiber cloth gets soiled, you can wash it out in the sink. This flesh-colored cloth is great for comparing the IDEAL implant to a silicone gel implant side by side. When you do this, it is apparent to women that the implants have about the same natural feel. We have devised a user-friendly online ordering system. You select the implant sizes you want and charge your credit card. Backup implants are loaned at no charge. For returns, call FedEx for pickup. When the implants get back to our distribution center, you will get a refund on your credit card. Shipping both ways is free for 3rd business day FedEx. Faster delivery is available for a small charge. If you have questions, just call our customer service department. The IDEAL implant is the first new type of breast implant in over 30 years. No longer does a woman have to choose between a saline implant for peace of mind and a silicone gel implant for natural feel. With the IDEAL implant, she can have the best of both, natural feel without silent rupture. This is an exciting time for women and for plastic surgeons. I am happy that your practice is playing a part in offering women the IDEAL implant.